Statewide, health leaders say they are seeing an increase in COVID cases. They are encouraging people to get the new COVID-19 vaccine when it becomes available in the next several weeks.
Kentucky's summer surge is sending more and more people to emergency rooms. Take a look. We've shaded a month-by-month look at cases so far this year in blue. 2023 is in dark gray. And except for the months of February, April, and May, we've seen more people with COVID in ERs this year. And that number really took off in July and again this month. WKYT's Phil Pendleton talked with health officials in Pulaski County about why this new vaccine is important.
COVID-19 numbers are running ahead of what health leaders say they were seeing this time last year.
There's a return to school, so students are back in the classrooms in close proximities, and that's one of the reasons we think that maybe there's some increase this month.
A new variant is causing people to have fevers, shortness of breath, coughing, and other symptoms. A new vaccine should arrive in about 3 weeks.
Not necessarily going to completely stop you from getting COVID. It's designed to help it be less impactful on you.
And no vaccines are currently being given out here right now for COVID-19. Health leaders are being told to wait for this new vaccine, which does address the new variants of COVID-19. The new vaccine is arriving as health leaders say hospitals across the state are seeing more admissions.
Hospitalizations are sitting at about 880 for the month of August, and that for emergency room visits, we're just over about 4,000 emergency room visits in August.
Doctors at Lake Cumberland Regional Hospital also say there's been a marked increase over the past 2 to 3 weeks.
It's not going away, but we do hope that with the vaccinations, we can keep the numbers from rising anymore.
In Pulaski County, Phil Pendleton, WKYT.
Lake Cumberland district health leaders say the exact numbers are harder to gauge now because so many people just take tests at home.